Bailey Boushay is definitely a unique, one-of-a-kind experience. I think the care that happens here far extends beyond its walls.
People come to the Bailey Boushay House with a host of challenges. Most have HIV/AIDS. Some are destitute, homeless, or alone. Others have mental illness or chemical dependencies. A few are near death. Though it may sound hopeless, their experience here is quite the opposite. Our clients are cared for by a team of top-notch nurses, professionals, and volunteers who are wholly dedicated to the understanding of each patient's needs and desires.
I think it's unique that Bailey does put the patients first. I think there are a lot of facilities and a lot of places that provide care that are kind of driven from the employer's side rather than from the people that they serve.
It's a level of care unparalleled in the industry, due in part to the highest staff-to-client ratio of any facility of this type, anywhere. Even the atmosphere is heartening. Artwork lines the walls, infusing the senses with a connection to the human spirit. Plants breathe life into light-filled spaces. The air is clean. The rooms are comfortable, inviting. Some are calm and meditative. Others are vibrant with laughter and conversation. It is not a place of sadness. It is a place of hope.
The change from a person that you first see walk through the door, that you may hear horror stories of, on how they're so difficult, they don't have any life skills to help manage things. And then through this process, you see them kind of open up and you see them start to smile and you see them start to interact and talk and share parts of their life that you would otherwise have no idea of the beauty that's inside this person. Sometimes they are remarkable and they do build enough life skills so that they're able to go home into a home rather than out on the street.
The truth is, many of our patients are unaccustomed to receiving the simple respect and care that every human deserves. They are facing serious health issues, yet they have been overlooked and underserved by the system.
Respect affects their healing. The term we use is to make them more self-sufficient. And so they would not feel, if they didn't feel the respect, they wouldn't come here to get the tools to be more self-sufficient.
Luckily, they have found their way to Bailey Boushay House, where the staff truly cares and the environment nurtures each individual. Through medication management, art and music workshops, occupational and physical therapies, counseling, camaraderie, and structured activities, we strive to foster a sense of pride, creativity, and independence in each person.
To always put the patient first means that the patient has control over how they heal.
It didn't matter what you did. If you wanted to get better, not wanted to get better, take your medicine that day, not take your medicine that day. It didn't matter what you did, they were loving anyway. And that was the thing that was amazing.
In 1992, Bailey Boushay House became America's first skilled nursing facility designed and built to meet the needs of people dying from AIDS. Thankfully, the face of AIDS has changed, and so have we, evolving into a health-oriented facility where people can manage their illness and live in dignity.
When I first started volunteering, people came to Bailey Boushay to die, basically. People were dying with AIDS, and now people are living with AIDS.
With some 100 staff members and 150 volunteers, we spend considerably more time with each individual than in a typical nursing home. finding every way we can to increase the pleasures of living and ease the pains of dying. Our adult day health program is for HIV/AIDS patients who need daily assistance but don't require full-time care. We encourage healthful and independent living in a variety of ways, one of the most important being medication management.
If it wasn't for the nurses down in the nurses station making up my medicine every week, I don't know if I could handle it.
Through healthcare services, support, and socialization, people have a chance to feel empowered and experience a higher quality of living.
To me, Bailey is a very integral part of my social interaction with the world. It's just nice to know that, for me, that I'm not alone, that there are people that really care for me.
There's a lot of things to keep people busy here. There's occupational therapy, there's physical therapy, there's massage therapy, there's speech therapy, there's counseling, there's substance abuse counseling, there's psychological counseling, there's dietary counseling, there's activities, there's art therapy, there's music therapy, there's everything. It's limitless.
Bailey Boushay is not your typical nursing home. It's more like a home with nurses.
When I got here, oh gosh, it was like heaven compared to where I was before. It's a wonderful place here. The staff is good. I think anyone that's looking for a place, that's going to be their home, this would be it.
We serve patients suffering from HIV/AIDS and offer end-of-life care for those with cancer and other acute illnesses. Around-the-clock care is provided by highly qualified clinicians who treat the whole person, not just the diagnosis, helping residents retain as much independence as possible. As a licensed nursing facility, we're able to provide medications that not only treat the disease, but offer pain relief, comfort, and a better quality of life.
The main benefit is you get to be the family member again instead of trying to be the nurse and the doctor and the nurse's aide and the pharmacist. You are surrounded by professional people that give you the confidence and take away a lot of the fear that surrounds people who are ill, people who are dying.
The residence includes 35 private rooms, which can be decorated and individualized to make each patient feel more at home. Every room has a 7-foot couch for friends or family members who need a place to rest or sleep. We also have dining and living rooms, a meditation room, a greenhouse, and several solaria.
I was continually amazed by the love and care that people sent my way here. I think there's a lot of love floating around this place. And it must have just seeped into me because it gave me a renewed will to live.
The dream of Bailey Boushay House was made a reality by the generous community support of thousands of donors who helped raise millions of dollars for the project. Unfortunately, AIDS is not going away. So philanthropy continues to play a crucial role in our success as we ask people to give from their hearts and help us continue this good work.
I really don't know where I'd be if it wasn't for Bailey. Bailey has been such an incredible support for me. Lets me know that maybe there is hope.
I think the most important thing is that I'm treated with respect.
It's not a hospital, it's not a nursing home. It's a house, it's a home.
This is home. This is home away from home.